name's Dr. Jake LaVere. I have my lovely assistant Jessica here. I'm located at Tarpon Springs, and we're going to talk about hip and ankle dysfunction, seeing how kinesiology tape and CLX can limit some of the pain that's involved, and look at some rehab techniques that has worked really well in my office. When we're looking at ankle, we talked a little bit about that last time I talked. We work with a lot of timing, balance, and coordination. And as we lose some of those, or we get a disconnect, then we do have some aberrant biomechanical issues that occur. Us being chiropractors, we have a great tool in our bag to be able to mobilize the joints and making sure that that movement is working properly. But someone comes in with a structural issue, those are really easy to fix. It's the function that we always have a hard time with, and a lot of times the patient is causing their own pain. It occurs time and time again, and over time something gives, you get a weak link. And so when I talk about ankle and hip, I talk about mobilizers and mobilizers. And when those range of motions start dissipating, then you start adding stress to the stabilizers, which is the knee and the low back, and we want to avoid those, and those are chronic with a lot of our patients. So the first thing that I do, and this is something that I do with every single athletic team, kid, professional, all in between, is I want to check one thing, and one thing first, and it's what's called the second heart of the human body. It's the Soleus muscle. It's the deep calf muscle. The great saphenous vein runs right through there, and it helps pump all the blood back. And so it's a lot of times overused with sports. It's never checked for trigger points. And trigger points can cause a number of different issues, especially one that activates more torque on the ACL. And so you see these non-contact ACL tears. This is one of the big reasons why they occur. And it's such an easy thing to check. We want to look at full range of motion of that soleus. So the soleus is going to be the deep calf muscle. And so the only way to really palpate it is with a little bit of flexion, okay, down to 90 degrees. But what we want to see is if we want to see any tautness that's developing in that calf. And so what I want Jessica to do is just do a squat with shoulder width apart, and we're going to take that button all the way down. We want to take a look at those heels and where she's positioned. How does that feel? Good? Okay. What you will find if there is a dysfunction within the soleus that will eventually cause some ankle pain and some knee pain is you will see those heels right up on one side compared to the other, and you'll see them fall backwards. Okay, so come back up. And if those occur, it's really easy to take care of, especially with our handheld foam rollers that we get with TheraBand. It's something that takes just a few minutes because an epoxic area, trigger point is an epoxic area that's not getting oxygen. So we want to bring blood flow to the area, feed that muscle to allow that proper contraction and relaxation occur again. The next thing that I look for is balance, which we talked about that before, so I don't want to kind of go through that again, but I do like to see balance in every single phase of the gait cycle. So dorsiflexion, plantar flexion, supination and pronation. And I want to use either a slant board or a makeshift slant board with 2 TheraBand pads. So very easy to do and very quick to duplicate. And this is something that you could allow the patient to purchase, so they have this at home. It'll be a lot cheaper than getting something off another store, and it's quick and easy and very mobile. The next thing I want to look for is I want to look what their internal clock is doing. And what I mean by that is dynamic stability. I want to see how they're moving. And the way I do that is a little bit of march in place is dynamic movement. So what they're doing is they're balancing from one leg to the next. Now this is usually pretty easy. Let's get some arm swing in there. And then when you're ready, I want you to close your eyes. And the reason I have her close her eyes is because we have 3 balance components that we want to pay attention to. Vestibular, which we're very visual creatures. As that goes, we see we have to rely on a couple other things. We have vestibular, where our head thinks it is in space, and proprioception, where our body thinks it is in space. We're testing what her proprioception is doing and how is she operating. I want to see that she could stay in the same place. A little bit of forward movement isn't bad, but rotation is going to cause concern. So let's say if this person was a runner and we saw a 45-degree rotation, then guess what? When they're running, they're spending more energy keeping themselves from going to the left than the right. That's going to throw off their balance, their coordination, and of course they're going to be inconsistent. You could open up your eyes. You did really good. Very good. I had someone I did this to, and they did a 360, and we had them open up their eyes, and they said, "Oh, I did fantastic," right? Well, we had some work to do, but that's something we want to know, because if their internal clock is moving them one direction or not, we could be working all this all the time, but we're not going to get the results that we want, because eventually it's going to become a disconnect later on. So we want to test this, and with us being chiropractors, we have a fantastic way with manipulation to correct that slowly, and then the test becomes the exercise. The next thing I want to do is I want to look at internal and external rotation of the hip, okay? And this is what we want to see. We want to see a good 90 degrees when that knee is resting and gravity's taking place, okay? So that's looking at the external rotation of that hip. Next, we're going to do the next leg. And we can see this isn't so bad. A little higher on that side, might be a little tighter, okay? But these are easy things that the patient can do to work on themselves, because we know that if we could increase the external rotation, all right, that's going to give us more range of motion in a run, and we're going to not put so much stress on the knee and the low back, because we're going to have proper firing patterns. When we lose rotation, the firing patterns change, and we get aberrant muscle balance, okay? And next thing, we're going to come over here. Now we're going to do the same thing, except we want to see the internal rotation. And so you're going to be on your back. Yep. All right. And this is called cross crawl. And at first, we're just going to you're going to put your knees down. You're going to be flat on the, yep. At first, we're just going to look at one knee coming up. I want to bring this to your chest. Good. And then back down. All right. And do this very slowly. And I'm going to point something out. You see the foot rotate in, causing a little bit of external rotation. So what we want is we want this to go straight back. That's pretty tight, isn't it? That's normal. So what the patient thinks is normal is not reality, and we have to figure out how to sink that back in. And a lot of times it's not the muscles are so taut that we can't do it. It's just they don't know what they're supposed to do. And so if we train them a little bit of neuromuscular re-education, we could operate that very easily and change the way they run, move very quickly to keep them out of pain. I've had fantastic results with just these two hip exercises to get runners out of pain the first visit. And so it's usually just because of their inconsistency. Eventually the weak link crashes. This is a way to put them back into what we call perfect biomechanics. So the next thing we're going to do is this knee's going to come up, all right, down, and when I bring it back up, I want this hand to reach all the way back and then back down. So we're going to time this. So it's a timing thing where when we start this, that hand starts. Good. And then back down. And so we want to operate on that kinetic chain, making sure we could find a connection between the kinetic chain and our internal timing. Now, we have a lot of patients that have severe rotation, where that's as far as they go. So what we have to do is we have to counterbalance that somehow with this. And so the way we could operate that is if we have our CLX stand, we could use the bands to over-exaggerate and then eventually put a little more perturbation onto the opposite arm to add difficulty, increase the timing, and make it more of a real-life situation, because we want to emulate running the best we can without causing a bunch of stress on the different joints. So I'm going to scoot you back. There we go. And we're just going to put this right on the ankle. Okay, and back down. All right. And now let's just bring that knee up to your chest. and back down. So now what we do is we have external forces giving us the opportunity to have her do the perfect movement. And this could be an exercise that she does in her office, or in your office, but then also she takes one of these homes, and with the anchor, she's able to duplicate this at home, knowing that she's doing correct movement. And the idea is when they come back, if they were doing their exercises, they're able to do this without any external forces. So stay right there. We're going to add a little more difficulty. That guy's there. So this is not going to move, but we're going to work on the right arm timing with that left leg. Okay, so same thing. You're going to come up, finish at the same time, and then back down. All right. And the tension should be right in here. So what happens with runners is eventually their glute med doesn't fire properly, or eventually fatigues and spasms and they start having pain. Piriformis syndrome is a very huge thing that occurs with runners, as well as hip bursts, and a lot of this can be avoided with this type of movement. So hopefully this helps with the next hip patient or ankle patient that you have, or even knee pain patient, that we might be able to coordinate a better game plan and get quicker results. So thank you very much for letting me speak, and have a wonderful day.